So greetings of peace. Assalamualaikum warahmatullahi ta'ala wa barakatuhu. We're down to our last part of the Unit 8, the basic nursing procedures, which is this video is focused on discussing the documentations that are used in the nursing field. So we have nursing care plan, we have nurses notes. Now, so nurses notes, we have two formats that we usually use. We have the SOP, the SOAP, or the FDAR documentation. So let's discuss first the nursing care plan. So from the word nursing care plan. So these are nursing interventions that we planned for the benefit of the patient. Now, this nursing care plan is made by using your nursing process. So if you can still remember your nursing process, the NCP utilizes nursing process to construct an individualized plan of care for a patient based on a critical analysis of patient assessment data. So again, review natin the nursing process. So it has 5 phases: assessment, diagnosis, planning, implementation, and evaluation. So the things that we planned for our patient is stated here in the nursing care plan. So it starts with getting assessment data. We have 2 types of data again. We have the subjective data and the objective data. After getting the cues of subjective cues and your objective data or cues, then we will have your diagnosis. Again, the diagnosis, nursing diagnosis has 3 parts: the problem of the patient, the etiology or the reason or the cause of the problem of the patient, and then the signs and symptoms. So PES. So nursing diagnosis can be a wellness, can be a risk, can be a wellness, a syndrome, or possible nursing diagnosis. So after the diagnosis, we will now plan activities, the goals, settings, okay? We'll plan for certain specific activities if it's independent activities, interdependent, or dependent nursing interventions. So the goals should be SMART, specific, measurable, attainable, and realistic and time bounded. So after that, after planning, then we will go to implementation. So everything that you have taken planned out activities, so you have to implement that one. And afterwards, evaluation. You will evaluate if the care is effective for the patient. So what is NCP? It is a written guideline for client care. It is an established plan of care based on the prioritized needs of the patient. So what are the purposes of your nursing care plan? First, it organizes the work of the nurses. This coordinates resources of care and enhances the continuity of the care. So this is what looks nursing care plan like. Okay, so we have here the cues. So here are the cues. You will put here your subjective data and your objective data. The nursing diagnosis, we have your objectives. These are your goals. It's either short-term goals or a long-term. And then we have the interventions. You have to place, first you have to write the independent nursing interventions, and afterwards the dependent interventions, and then the interdependent interventions. And then you will also place the rationale. Rationale, when we talk about rationale, it is the reason why you implement those interventions. And then lastly, your evaluation. What are your expectations? Okay? What are your expected outcomes to your patient? So example of a nursing care plan. So example, assessment, or your another example of nursing care plan also, other than using your cues, we have also instead assessment. Okay, so we have here the subjective and objective. We have the diagnosis, the inference. There are some nursing care plan or hospitals that uses or that includes inference. Okay, so inference, these are the main to call this. Usually this includes the diagnosis of the patient. Okay, so we have also the planning, and then we had intervention. So they use the term planning instead of objectives. They have the interventions, the rationale, and the evaluation. Okay, so again, we have also here another example. So, assessment, diagnosis, inference, planning, intervention, the rationale, and evaluation. So, that's an example of your nursing care plan. Again, the nursing care plan is individualized nursing plan for the care of the patient. So, it is based on what the things that you have assessed from the patient. So, by understanding the needs of the patient, by understanding the data of your patient, you will now draw a conclusion or a diagnosis of the patient. Now, based on the diagnosis, based on the NANDA or Nurses Association of Nursing Diagnosis, North American Nursing Diagnosis Association, the book, they have packet guide for nurses. We can use that one as your standard nursing diagnosis. So, by that, you will now identify what are your objectives. It can be short-term or long-term goals, especially if the patient is your primary patient. When we say primary patient, it depends on how long the patient will stay there in the hospital, and then the care is based on the time when you will take care of the patient. So now let's talk about the nurse's notes. So if the nursing care plan is more on future, what are your plans for the patient? Nurses' notes are documentation of what are the things that you have done to your patient. So this is past tense. What are the things that have been intervened or given interventions for your patient? So nurses' notes is a documentation that is crucial aspect of patient care because it provides healthcare professionals with important information about the patient's or client's past and current medical status. Preparing optimal patient progress notes that include relevant details requires specialized knowledge. Now, a standard documentation framework like SOAP or SOAP or FDAR can help healthcare providers write a comprehensive, organized progress notes that support high-quality patient care. Now, in a patient's chart, there are specific forms that are for specific medical healthcare practitioner. Okay, so we have the patient's profile. So usually this is more on the admin or the one who received the patient. They're the one who write this, okay, or to write inputs about that one. And then we have also the doctor's notes, okay, the progress notes of the doctors when doing the rounds. We have also the vital sheets forms. We have also the medication sheet. Okay, so any type of charts has specific medical or healthcare provider is assigned to it. So as nurses, we have specific part of the chart, which is the nurse's notes, which documents or a documentation of the interventions that has been done by the nurses on the patient and the progress of the patient that is noted by the nurses. Okay, so we have here SOAP or SOAP. Okay, so SOAP or SOAP, we can use that one. So SOAP is more on subjective, objective data, the assessment or the nursing diagnosis, and P for nurse planning. So SOAP, more on the plan. Okay, so with the SOAP, we include the interventions and the implementation or the evaluation. So SOAP charting tips. Review identifying information on each chart to ensure that you're updating the correct file. Ask clarifying questions when interacting with patients to gather detailed information. Take brief notes during the appointment to guide in your in-depth SOAP chart afterwards. So again, you have to take note of the subjective data, your objective data. Your assessment is your nursing diagnosis. So based on the two data, you can derive to a specific nursing diagnosis. And then add dates and time to each SOAP note to provide continuity of the patient's care. And then use neutral language to uphold professionalism and avoid making assumptions. Include all relevant details from your interactions. Only write SOAP notes about your own interactions with patient. Do not include those were endorsed from you. So anything that you have not done to your patient must not be included in your SOAP documentation. Write neat, legible notes with consistent spacing to improve readability. And then when discussing multiple people, such as patient and their guardian, be clear about whom each statement addresses. Only use abbreviation or shorthand if they are standard for your organization. If it's not, then you have to avoid that one. Make new notes and add addendum to update the patient's records instead of altering previous chart. So example, you have started your chart or documentation at 8 a.m. time. Okay, kasi the first interventions that you had or in with your patient was done at 8 a.m. So you have to write those one. And then you've done or you carried out some doctor's order by the time of 3 p.m. So you have to add. Okay, so addendum at 8 a.m. shift, okay, 3 p.m. So the time, okay, so you have to include that one. So another type of documentation is your FDAR. So again, in hospital, there are here in the Philippines, especially here in Marawi City, we usually use FDAR documentation. However, in the previous time, we used SOPI, but it was changed to FDAR. Okay, so the difference between the two naman is for FDAR, focus, data, action, and response. Now, the focus is the problem. Okay, the main problem of the patient. It can be a nursing diagnosis, but it can be a specific problem. But more for easier for a neutral language, we usually use the problem only. Okay, we don't usually add or use nursing diagnosis. Okay, not because some or most of the nurses are not really comfortable when using nursing diagnosis, but ideally it can be used or it can be placed with problem or nursing diagnosis of the patient. So FDAR stands for focused, data, action, and response. So focus, this is the subjective or purpose of the note. The focus can be a nursing diagnosis, an event or a patient event or concern. So example, mission, transfer, discharge, stitching. We have also code blue, vomiting, coughing, or any problem of the patient that you wish to address. Okay? So data, this is the written in the narrative that contains only subjective or what the patient says and the things that are not measurable, and objective data, what you assess and findings such as vital signs and things that are measurable. So data, from the word data, it's either be subjective or objective data. This lays the supporting evidence for why you are writing the notes. Example, code blue. So why? Vital signs, so the patient has hypotachytachy, hypotensive, tachycardic, and tachypneic. Okay, so that's the reason why. So you have to put the specific evidences that supports the focus. So another example, the focus was vomiting. So you have to put the data if the patient, if he or she reported feeling nauseous, and then you have to put the characteristics of the vomitus. Okay, so is it a projectile vomiting, okay, or the vomiting, or how the frequency of the vomiting incident of the patient. So if it's coughing naman, so we can use if the problem is coughing, okay, so we can use it in the data. You have to put if there is a productive cough or non-productive cough, and then what are the lung sounds. So the data is very specific on very specific. It serves as the evidence of the focus. Okay, so it may include normal findings, but when we use FDAR, because this is a focused documentation, usually we add data that supports the focus or the problem. So you are letting the sender or the reader know this is what the patient is saying and what I am seeing. For action, okay, this is the verb area. In this section, you are going to write what you did about the findings you found in the data on data part of the note. So this includes your nursing intervention, such as calling the doctor, checking the doctor's order, regulating the IV flow, okay, providing bedside care, providing comfort, how to call this, raise the side rails, okay, so things like that. This part of the documentation is where you will write your interventions. And then for the response, this is where you write how the patient responded to your action. Sometimes you won't chart the response for several minutes or hours later. So what is FDAR charting and why it is used? It is a method of charting nurses use along with other disciplines to help focus on a specific patient problem, concern, or event. It is geared to save time and decrease duplicate charting. It is a great charting method for nurses who have lots of patients, and it is easier read by other professional. That's why when I said earlier that here in Philippine setting, especially here in Marawi City, because we don't have the ideal population of patient nurse patient ratio, we use this charting because it is more on not really time consuming, unlike SOPI, because we have to give the subjective, the objective, the assessment, which is specifically the nursing diagnosis, the planning. Sa SOPI, in SOPI, we use the specific assessment, the A assessment, as the nursing diagnosis. It is only nursing diagnosis. We cannot write a problem there or an event. Here, sa FDAR, we can use a problem or an event that will happen to your or the patient must have undergone. So it is more on saving time to the patient, to the nurse, especially if they are catering 60 to 100 patients. So actually here in the Philippine setting, the nurse patient ratio is not really on the ideal side. Okay, it's because of poor healthcare system in the Philippines. So that's why it's very sad here. Okay, so it gives other professional a snapshot of what went on during your shift in a concise manner. So again, we have here a sample. So we have the SOPI, patient's name. Do not forget the patient's profile, the name, the case number, the age of the patient, the address, the chief complaint, the diagnosis. Okay, so again, the SOPI is the standard or the subjective, O, objective data, the A is your nursing diagnosis, then P, your goal, okay, or your plan, and then your interventions, and then E, the evaluation. So here for the progress note or FDAR, as you can see here, the focus, the date and time, and then the focus, and then the progress notes, the data, received patient, blah blah blah. Okay, vital signs. Okay, and then A, what are the actions given, morphine, like that, and then R, response, patient rate pain is from 22 to 10 out of the state, which is the patient states I feel much better. So as you can see, if we try to compare this two, the FDAR is much more concise and then much more specific than this one. Okay. However, if we wish to check for a documentation that is more detailed, it's actually the SOP, because it is very detailed with the nursing interventions for the with the planning, with your nursing interventions. Okay, so it's very more on very detailed part. Okay, so I think that's all for the nurses notes. Again, in the documentation process, it's very important what I have said earlier. What is done should be documented. What is not done should not be documented. And in the policies or guidelines and documentation, do not document things that you have not done, and also do not document for another person. You document your own actions. You document your own patients. So if some nurses or your colleagues would ask you na, okay, can you please write this one for me, like that, do not do it. Okay, as much as possible, because documentation serves as your legal basis of care and interventions to your patient. And this documentation, this piece of paper, this nurse's note will save you in times of legalities or legal problems that you may encounter during your journey as a nurse. So thank you for watching this video. Again, if you have inquiries, you have questions, please do not hesitate to ask directly in the video. State your question so that I can answer it. I can read it and answer it for you. So thank you once again, and wassalam.